All right. We're going to jump right in. So the first question, it talks a little bit about women and what they can do to start to get ready for pregnancy. And when I thought back to when my wife and I first started having children, I don't know if you were any different, Kelly. I don't recall her having a conversation with her provider to prepare necessarily. She kind of gave me the green light. We were ready to try, and doggone it, we got pregnant way too fast, in my opinion. But it was one of those types of things. So did you have a conversation with your provider, Kelly, as you started to prepare for your family?
All I learned about having babies is how not to have them,
Okay.
like most of us in high school, and that sometimes works and sometimes not.
Right.
So our first pregnancy was a surprise, a great surprise, but a big. Unprepared. All I know about telling my husband about having a baby is what I learned on Full House, which is not much. And so, yeah, I didn't have any conversations with my provider about how to become pregnant. No.
Yeah, and I don't recall it either. And like I said, I realize not all pregnancies can be planned, but ours was our first one. So Dr. Harsha, educate us on out there getting ready to start a family. Like, what are some things that they can start to do to get ready and start the journey?
Yeah, it's a great question. I mean, I think both of your experiences speak to the fact that not, most, well, I shouldn't say most, about half of pregnancies are unplanned in the US. So if you're finding yourself pregnant and you haven't planned for it, it's okay. We still have lots of great advice for you and want to help you through what can be a really wonderful journey. But when you're thinking about starting a family and wanting to become pregnant, I think it's important to kind of approach it like you're going to be going through a major physical stress test, right? Pregnancy is a huge change and a huge stress on your body, for a great reward at the end. But there's a lot of things that we care about. So for the pregnancy side of things, in terms of having a healthy fetus or healthy baby, we want women to start thinking about taking prenatal vitamins with folic acid. It's very important to be full of folic acid prior to conception, if you can be, because the reason we care about that is something called neural tube defects, which is basically brain and spinal cord problems that happen in women or for babies of women who don't have enough folic acid. And if you are full or sort of have enough, your risk of neural tube defects goes down by about 75%. So it's a big deal, and it happens very early on. So it's like 5 or 6 weeks of pregnancy. You may have just missed your period, and at that point, we already want you to be on the folic acid. So if you have the luxury of planning, then you should start a prenatal vitamin, 400 at least milligrams of folic acid a day. And then thinking about everything else that you can do to optimize your health, right? If you have chronic medical conditions, it's really important to talk to your doctor about whether they're under good control. Are there other things that you can do to get better control? And are the medications that you're taking safe to be taking in pregnancy? And if you consider yourself somebody who's very healthy, then thinking about things that you can do to optimize your mental health and your stress in your life and other things that can become more challenging in pregnancy. I did want to say one other thing. I think it's really important to remember that it's a two-person game, right? We talk a lot in pregnancy and like maternal health about what the woman can do and everything the woman shouldn't do and everything like that, right? Mm-hmm. But actually there's some really interesting research out there about the role of the dad, even prior to pregnancy. So for example, babies born to dads who drink too much or who smoke or who use substances, even if the mom doesn't use those things, their babies can have similar problems, developmental problems, birth defects, things like that. So guys are not let off the hook here.
I love it. And we shouldn't be.
No.
We're part of the whole process. We play a role. I think we were
you play an important role. Yeah. Yes.
No, absolutely. And I love that, because you're right. I don't think we often think about, well, what can the guy also do to help play a part in that as well? Because you're absolutely right. I think that's great advice.